So basically here, always my motto is share knowledge, gain knowledge. So if I share my knowledge, I will gain knowledge. Okay. And today we are going to have in-depth CPT surgery or same-day surgery coding free demo. Anyway, I will post this in the YouTube channel. No need to worry. And I would like to tell about me. So my name is Harish Gupta. So I have nearly 9 years experience in medical coding, including all specialties. Currently, I am working as a auditor, medical coding auditor for same day surgery specialty. Okay. And I have two YouTube channels, Fast Coder 21 and Super Coder 21. I am the creator of all these channels. In my channels, you will find all the information related to all specialties like inpatient coding, surgery coding, denials, anesthesia, ED, whatever you want. Just you need to mention comment. So I need this topic. So I will create videos. Okay. So I have two YouTube channels. Fast Coder 21 is English and Super Coder 21 is Telugu. Okay. Next, how to master surgery coding. So whenever you want to master any type of coding, we need to understand CPT book or ICD-10 CM book. So if you master your CPT book, you will master your surgery coding. Why means most of the guidelines we need to use from CPT book only. So whenever we starts with fundamentals, first we will learn to introduction to CPT surgery section. Okay. So here I will teach you how to identify the guidelines and what is the layout and what is the meaning of each and every symbol in the CPT code book, so that you can understand what is the purpose of these symbols and what can I do if I see that symbol. Next one is surgical package concept. In CPT coding, one of the most important concept is surgical package. So if you understand surgical package concept, you can code any type of surgery in easy steps. So this surgical package includes global periods and separately reportable services. So here, basically during surgical package concept, I will teach you how to identify major procedure and how to identify minor procedure. Okay. So what do you do if the patient performs both major procedure as well as minor procedure? Which one we need to take? So that I will teach during the live session. And also, as all of you know, you might have completed the CPC examination. So modifiers plays very important role in CPC certification as well as surgery live coding also. Okay. So and under fundamentals, we will learn modifiers also along with these basic concepts. Okay. Next, we will learn specialty based coding. Okay. First, we will start with plastic and reconstructive surgery, where we will learn flaps, grafts, how to identify cosmetic procedures, and how to identify reconstructive procedure. So after completion of this plastic and reconstructive surgery, which comes under integumentary system, you will get good understanding of what is the flap, what is graft, and what is the reconstructive procedure. So how to code skin substitute grafts, okay, and how to code debridements, how to code burns, how to code Mohs surgery, how to code next breast reconstructive procedures. I mean same day surgery most of the time. These are the common procedures you will encounter. Okay. So after integumentary system, we have musculoskeletal system. Usually we'll call it as orthopedic surgery. Okay. Here we will learn fracture care. So fracture care guidelines are very important for interviews as well as our live coding also. In fracture care, we will learn. So how to code splint application. So what are the approaches in fracture care? So what is the difference between open procedure as well as closure procedure? Okay. And also what is the difference between skeletal tractions? Okay. And also what is the difference between arthroscopy procedure and arthroplasty? So what are amputations? Okay. And also we will learn joint replacements. Okay, most of the time in the ambulatory surgery setting, we will get knee replacement. So here we will learn knee replacement during this orthopedic surgery coding session. Okay. Next we have cardiovascular and thoracic surgery. So in cardiovascular and thoracic surgery and respiratory, we will learn most common procedure from respiratory system sinus endoscopy procedure. Usually we'll call it as FESS. Okay. So functional endoscopic sinus surgery, which are the common procedures you will encounter in the live surgery coding, where you will learn how to code ethmoidectomy procedures, how to code mucosal resections, how to code ablations, how to code what do you call nasal perforations, okay, how to code septoplasty. All those you can learn under respiratory system. Under cardiovascular and thoracic surgery, we will learn dialysis basics. Here we will learn how to identify the AV grafts and AV fissulas. Okay, how to code AV fissulas and how to identify the anastomosis. Okay, next we will learn complications related to AV fissulas and AV grafts. These are also very important complications. So physician will perform the AV grafts or AV fissulas. So why do physicians perform AV grafts, guys? What is the purpose of AV grafts and AV fissulas? Anyone knows? So
Hemodialysis.
yeah, perfect. Yeah, the purpose of AV grafts and AV fissulas is for hemodialysis. Okay. So what happens after few days if there is a obstruction or stenosis in the grafts? So again, physician needs to perform the procedures. Okay, where we have nearly 10 codes. We will learn all 10 codes using like how to identify peripheral dialysis circuit, how to identify central dialysis circuit. So those things we will learn during our live coding. And also we will learn IVR basics. So in our live training, I will teach you how to identify appendix L. So if you know appendix L, you can code any chart in easy way. Okay, and also I will teach you catheterization and what are the types of catheterizations, how to identify catheterization procedures. Okay, so what are the codes needed for catheterizations, how to identify the families. So all those we can learn in the catheterizations. Okay, next we have digestive system. So digestive system is one of the most frequent and regular concept in ambulatory surgery coding. In digestive system we need to understand three concepts. Okay, first one is EGD, next one is ERCP, next one is colonoscopy. So during this procedure we will learn what are screening procedures. So how to identify screening procedure and how to identify diagnostic procedure and how to identify therapeutic procedure. So what are the guidelines related to screening colonoscopies? Okay. So what is the difference between EGD and ERCP? How do you identify EGD and ERCP? So anyone knows ERCP, guys? What is ERCP?
Esophagogastroduodenoscopy.
Yeah, esophagogastroduodenoscopy. Okay, sorry, endoscopic retrograde pancreatography. Okay, ERCP, endoscopic retrograde cholangiopancreatography. ERCP. Just try to remember the abbreviation. E means endoscopic, R means retrograde, endoscopic retrograde. C means cholangio, P means pancreatography. So endoscopic retrograde cholangiopancreatography. So in our live coding we will learn what is the difference between retrograde and antegrade. So how to identify retrograde and antegrade we will learn during our live coding. And also colonoscopy, how to identify screening procedure. So for example, you have the document, colonoscopy report. How do you identify whether it is screening, diagnostic or therapeutic? So those things we will learn during our training. Okay. And also for related to colonoscopy, we have very important topics for interviews also. Like how do you apply like make screening colonoscopy guidelines related to Medicare. So when do you use CPT code or when do you use G codes? Okay, mostly we'll use G codes for Medicare patients. If the patient came in for hospital for colonoscopy, if the patient is Medicare patients, based on the operating report, we need to use G codes. So we will learn all those G codes. Okay, and also from the digestive system, we have very important topics related to appendix as well as gallbladder, like appendectomy and cholecystectomy. And also from the digestive system, one of the most important topic is hernia repairs. Okay. So hernia repairs also we will learn how to code multiple hernias. Okay. So what are the keywords to check while coding hernia repairs? Why means hernia repairs also one of the most important topic. Okay. How to approach the procedure? What are the keywords to identify in the operative report? Okay. So if you see male genital and female and delivery, so we will learn in male genital system we have phimosis is the most important and few prostate procedures. Okay. And if you see urinary system, cystoerythroscopy is very important concept. Okay. In from urinary system we will learn cystoerythroscopy all procedures. So what is lithotripsy, what is double J stent, all those important topics we will learn during our urinary system coding. From the maternity care and delivery, we will learn what is global care period. Okay, what is the global care? So when do you code? Like delivery concepts, how to code delivery reports. So we learn during our maternity care and delivery. Okay, from the nervous system point of view, we will learn laminectomies or laminotomies. Okay, as well as we have discussed previously, most important one, pain management, how to identify ESIs, okay, and TFPSA, as well as facet joint injections, as well as medial branch blank. All we will learn during our nervous system coding. Okay, so these are very important during live surgery. So we will learn all those important topics. Okay, next these are the advanced concepts. Okay, so whenever you code any type of operating report, within 2 to 3 lines, you need to understand whether it is laparoscopic or endoscopic procedure or open procedure. If you understand that, 90% you will get rid of your tension. Okay. So those key topics we will learn during our live coding. So how to identify endoscopic procedure, how to identify open procedure, what are the keywords, those we will learn. And also we will learn bundling and unbundling, NCCI edits. Okay. So we will learn what is bundling and what is unbundling using the NCCI edits. Okay. And also we will learn inpatient versus outpatient surgery coding differences. Why few procedures will be performed in inpatient and why few procedures will performed in the outpatient. What is the difference? Why did they differentiate both procedures? That we will learn. And we will learn common dimensional surgery coding using practical scenarios. Okay. So why means most of the time if you go to interviews, they will ask you all these basics. Basically these are basics. Okay. So these are the common things you will encounter during the interviews also. Next one, next we will learn all these concepts. Along with those, we will learn all these. First, we will learn NCCI edits. Okay. So how to apply NCCI edits. Okay. Next, we will learn common surgical instruments. So if you know the instruments, you can understand the operative report easily. So we will learn common surgical instruments. Next, we will learn types of incisions. Why means based on incision, we can understand what is the anticipated procedure by the physician. Okay. Next, surgical positions. Why means in surgery coding, each and every surgery is having separate surgical position. So if you know those position, you can understand what physician is planning to perform. So we will learn those things. Next, we will learn OP report components. Okay. So what are the components of OP reports? So what are the important concept from where we need to pick the like codes or diagnosis. Okay. Next, we will learn choosing keywords from OP reports. As we have discussed previously, how to identify endoscopic procedure or open procedure. Okay. How to identify dissection, how to identify adhesions. All those basic things we will learn uh, using the keywords. Next, I will teach you how to use the index basically. Okay. So as all of you know, we have index in the CPT code book also. So I will teach you how to use that index for while coding. Okay. Next, I will show you 3M with Epic software, which you can't get anywhere. Okay. And also we'll use Codify software, where we will use most of the NCC edits. So we will use 3M and Codify for practical purpose. Okay. Next, I will teach you nearly 40 to 45 live chats with index leading. So just I will give you the chats and I will ask you to code. If you are unable to code, I will tell the answer and I will teach you how to lead the index. Okay. And also nearly before completing this session, you are going to learn nearly 3000 common interview questions for interviews or same day surgery coding interviews. Approximately 3000. Okay. So those are the most important ones you can encounter during your same day surgery coding interviews. Okay. And also I will teach you updates related to ICD-10 CM 2026. Anyway, this is November. So we will learn CPT 2026 updates also. Okay. And also I will provide 100% job assistance in India, UAE and USA. Okay. If you are from USA, I will provide job assistance in USA. If you are from India, I will provide job assistance in India. Okay. And also I will provide few materials and recordings related to our live coding sessions. Okay. So basically no need to worry. These all things included in this surgery or this surgery coding or in-depth surgery coding. So it will include dermatology, orthopedic surgery, respiratory, cardiothoracic, IVR, digestive system, urinary, OBGYN, nervous system and pain management. Okay. So for example, if you join this training, if the company is having requirement for pain management, you can apply for pain management. Okay. If any one company is having the requirement of GI coder, you can apply for GI coder. Okay. So like that, you are going to learn each and every topic in in-depth fashion. Okay. So next, if you want to watch our teaching process, you can watch this video. Already I have published in my YouTube channel. Okay. So